Hello, everyone. Welcome back to this year's CR Arthritis event at the Canadian Rheumatology Association and Arthritis Health Professions Association annual meeting in Winnipeg. I'm Kelly Lendvoy, VP of Communications and Public Affairs at Arthritis Consumer Experts, and we're bringing you the highlights from the annual meeting. And we're joined today by Dr. Daniel Viss. He's a respirologist and clinical lecturer of medicine at the University of Calgary. He also sees patients at South Health Campus Pulmonary Diagnostics Division, where he specializes in the diagnosis and treatment of many ailments and diseases affecting the lungs and respiratory system as a whole. Dr. Viss, welcome to the show.
Thank you.
Now, you had a presentation on the practical lessons in sarcoidosis management. And for our listeners and viewing audience, maybe that's a good place to start, and you can tell us what sarcoidosis is and how it intersects with inflammatory arthritis.
Awesome. Well, thanks for the question, Kelly.
Sure.
No, I think it's an important question as well, because sarcoidosis doesn't have as much name recognition as some of the other illnesses like lupus and rheumatoid arthritis. It may be a little bit less common, but it's out there. There's thousands of people in my city of Calgary that have sarcoidosis, and so it's not a 1 in a million diagnosis by any stretch. Sarcoidosis is an autoimmune condition that can involve any organ system in the body. I'm a lung specialist, and we specialize in sarcoidosis because most of the time the pulmonary system or the respiratory system is involved, at least 90% of the time. But one of the most other common areas that are involved are the joints. And so at least 20% of people with this condition experience significant joint pain as a result. It can involve the heart, the liver, the brain, the skin, the kidneys, certain blood abnormalities, kidney stones. Those are all a bit less common than the lung issues and even the arthritis issues. And so I was happy to be welcomed by the Rheumatology Association to talk about sarcoidosis today.
So is it an inflammatory process like arthritis, or rheumatoid arthritis as an example?
You got it. Exactly.
Okay.
And so yeah.
What are the similarities and differences, I guess, then in that inflammatory process?
Totally. And so in terms of similarities, the patients both experience pain. The patients have demonstrable blood work abnormalities. You can measure the inflammatory markers in their blood, and they're truly inflamed. This isn't just pain. This is arthritis. The differences are the way that pain, manifests over time. And some of the same joints that can be involved in the way that almost any joint can be involved. But in conditions like rheumatoid arthritis, the pain is a lot more destructive. And so patients' joints are eroded over time when they have a condition like rheumatoid arthritis. And, patients with sarcoid may have a lot of pain in their joints, but at least fortunately, they don't develop that same destruction of the joint that a rheumatoid arthritis patient may experience.
So with that in mind, and we were talking about the intersection before, how does this knowledge then inform how we treat and manage sarcoidosis, and how that can be tailored and modified if a person is also living with inflammatory arthritis?
Totally. And so arthritis is common, and inflammatory arthritis can have other causes besides sarcoidosis. And so my first step is always determining, is sarcoidosis the problem? And so cast a wide net. You're exactly right that some people have, sarcoidosis that causes inflammatory arthritis, and some patients also have sarcoidosis and rheumatoid arthritis. And so you have to look for all of these things. Because the condition is immune mediated, there's inflammation, there is a lot of overlap in terms of treatments that can be effective. And so despite them being different conditions, Prednisone is often used as a first-line therapy for inflammatory joint disease and for sarcoidosis. Methotrexate is often used as a medication for both of these conditions. And, many of the biologics, fortunately for sarcoidosis, were invented to treat more common conditions like rheumatoid arthritis, and then subsequently have been basically repurposed and utilized for sarcoidosis later on. And because it is another immune-mediated inflammatory condition, some of the rheumatoid arthritis treatments have been effective for sarcoidosis.
So, what about non-medication therapy? So I'm thinking of lifestyle modifications, diet, exercise. Recommended for sarcoidosis, I would imagine, but can also benefit a person who's living concurrently with a type of inflammatory arthritis.
Totally, and that would be yet another similarity. I would say that lifestyle intervention, particularly making sure you're getting enough sleep, so a proper sleep quality, trying to drink 2 liters of water a day and maintain a well-balanced diet. And targeting that 20 to 30 minutes of physical activity at least 4 days a week are as important or more important for sarcoidosis patients and inflammatory arthritis patients as other people. There is many things that we can do to worsen our symptoms. There is all sorts of ways that we can eat, all sorts of ways that we can change our lifestyle so that we're not moving as much, we can gain weight, and all of these things, even if they are not the cause of our rheumatoid arthritis or the cause of our sarcoidosis, make it harder for you to live with that disease because you're less fit, you may be heavier, you may not have the proper food that you need for energy. And in the case of sarcoidosis, you can actually run into specific problems like kidney stones as a result of following the wrong lifestyle or diet or not drinking enough water. And so I would say, in terms of counseling patients with sarcoidosis, I always say focus on making sure you're obtaining adequate hydration, making sure that you're getting good food from all the food groups while not overdoing vitamin D, which is a specific one for sarcoidosis. And then I tell my patients to get 7 to 9 hours of sleep per night, as we know that that quality of sleep is important for managing stress, reducing your risk of infection, promoting mental clarity, and giving you the energy to fight your autoimmune condition.
Okay. Finally, as part of their workshop, did you discuss any of the latest research findings on sarcoidosis that could have implications for inflammatory arthritis treatment?
There are some new treatments coming out for sarcoidosis. The other thing that's maybe a bit nice about them is that they are generally medications that are being repurposed from other usages. And so these are medications that are already on the market. They're already used. We already know the side effect profiles of them. Some medications like tofacitinib or medications like tocilizumab, which have been used for rheumatoid arthritis, are showing some promise for sarcoidosis. Medications like Humira have been used for a long time, not a long time, but at least 10 years to manage sarcoidosis with excellent effect. And so we're hopeful that in the pipeline of rheumatoid arthritis therapies that, more and more of them will eventually be shown to be effective and eventually repurposed for sarcoidosis as well. There is, one agent that's very early in studies right now that's actually sarcoidosis specific. But at this time, and for the foreseeable future, all the new and exciting treatments will be medications that are currently utilized to treat other autoimmune conditions.
Thanks for that summary. And I think for our audience, insightful in terms of highlighting for them another example of the interdisciplinary nature of managing inflammatory arthritis with another chronic disease. So we really appreciate you stopping by and sharing the highlights from your workshop and the work that you're doing. And we hope we're going to get a chance to do this again with you soon, Dr. Viss.
That's awesome. Thank you very much for having me, Kelly.
Of course. And thanks to our viewing audience for joining us. We look forward to bringing you more highlights from the annual meeting this week in Winnipeg. Thanks again for joining us. Bye-bye.